It is currently 10:30 on a Thursday, and you are working as a locum in a surgery. You are asked to call the following patient.
Hello?
Oh, hello there. Is that Mr. Park?
Yeah, it's Desmond here, yeah.
Hi, hello, Mr. Park. It's Dr. Allam here, one of the locum doctors from the surgery. I've been
Yeah.
asked to give you a call. How are
Yeah.
you, sir? How can I help?
Not too good. I had this cough for the last 3 days.
Hmm.
It's making me a bit out of breath, you know.
Oh dear. Okay.
Normal doctor gives me antibiotics and some steroids. Dr. Wilson. Yeah.
Right. And I can see you're on some inhalers for your breathing. Has your breathing been a problem for some time?
Yeah, well, just I smoke, you know, and the inhaler helps me, you know.
Yeah, sure. And it's just the inhalers you're on, or are you on a nebulizers at all or anything like that?
Well, I got this purple inhaler and a blue. I don't know what they blooming are.
Right.
And,
Okay.
yeah.
Fine. And you're saying to me that it's got worse in the last 3 days, the breathing?
Yeah, the cough's been quite bad, you know.
Right. And are you bringing anything up with that cough?
Yeah, excuse me. I've got a lot of mucky, you know, sputum coming out. So it's
What colour
a
is it?
bit more than normal, you know.
Yeah, sure. Is it any particular colour, the spit that you're bringing up?
You know, mucky and horrible, sort of yellowy, browny colour, you know.
Mm-hmm. Okay, a yellowy browny colour. Anything else at all?
Well, I had coughed off a bit of blood this morning, yeah. It's
Okay.
unusual. I don't normally do that.
Really? Okay. Oh dear, sorry, I can hear quite a bit of coughing there. Yeah.
Oh,
Is that a little bit of blood or a lot?
Well, I coughed up some blood, you know. It's
Sure.
blood, you know, not a little bit, but, you know, it wasn't loads,
Sure.
you know.
It's a difficult question, I appreciate, sir. I mean, do you think it was just specks of blood within the yellow
No, it was
spit
like
or
a big blob,
big blob?
in there, you know.
Okay. And your breathing's got a bit worse?
Yeah, I'm feeling it, you know, like I'm really
Sure.
tired and washed out, and
Yeah. Any temperatures at all?
well, I feel a bit hot, you know. I haven't really
Yeah.
measured my own temperature yet. I just know I feel blooming hot, and I only got a t-shirt on.
Oh gosh, okay. And how are you managing at home?
Well, you know, I say breathing's difficult with the coughing and, you know, finding it difficult breathing.
Sure. I was just wondering, I
The
mean,
normal doctor just gives it to me. I ring him up and he sorts me out some antibiotics and
some steroids. Yeah.
You know.
Yeah, well, it sounds like that's
Normal,
what you...
simple.
does sound like what you need. I'm just trying to gauge, you know, how serious this is compared to before, and also how you're managing at home. Are you home alone or...
I live with my wife, yeah.
Oh, good. Okay, so somebody's there with you. All right.
Yeah.
And if I was to do a prescription for you, would she be able to come and pick it up, do you think?
Well, yeah, I'd probably send her out. She could get it, yeah.
Now, I know that your normal doctor normally sorts you out with a prescription, but it would probably be quite a good idea to see you at some point, wouldn't it?
Right.
Would that be
Well,
possible at all?
Not today. Can't come today. I got a blooming take her to bridge this afternoon, see? Bloody bridge. But yeah, so I can't get out of that.
All right. So how are you going to do that? Are you driving her down or?
Well, it depends. If you say I can't, then I'll say I'm not driving. If you say I can, I'll say I am driving.
Right. Okay. I'm just a little concerned whether or not you're going to be safe to drive if you're feeling this poorly. What do you
Well,
think?
in all
How does it compare to how you've been in the
purposes, she's
past?
driving then, all right.
Okay. All right. Fine.
Oh, you know, I can come another day, but I can't come today.
Can't come today. All right. Okay.
Sorry.
Well, that's all right. Not at all, sir. Well, let's sort you out with that prescription.
Right.
You're not allergic to any antibiotics, are you, sir? Just
I
checking your record doesn't appear that way.
don't think so.
No.
I got a bit of blood pressure, you know.
Yeah, and I can see you've got the blood pressure tablets and also the tablets for your diabetes. Yeah.
Yeah.
Good. Okay.
I
Well,
also take some sort of cholesterol tablet, but I don't blooming know what to bloody call it.
sure. Well, I'll look back to see what
probably got it on
what
the
they
list
usually
there.
give you for when your breathing gets worse and sort you out with that. But I think it would be a good idea for you to come and see us at some point.
Yeah.
Do you think you could do that with tomorrow in the next couple of days?
Yeah, tomorrow I can make it in tomorrow.
Okay. All right then.
That'll be fine.
Fine. Well, if I'll just pass you back to the reception and try and sort you out with an appointment for tomorrow. Is that all right, sir?
Lovely. Thanks very much.
Okay. All the best. Any problems, you just let us know, okay?
Thank you.
All right. Bye now.
All right.
It is important to address both patients' and doctors' agendas. At times, it can be appropriate to share your concerns with a patient so that they can understand why you are promoting a certain management plan, as this can help with adherence. For example, coughing up blood can be part of a chest infection, but could also indicate a more serious condition, such as cancer. It is important to negotiate when a patient has fixed ideas about the outcome of the consultation. Safety nets should be specific in both symptoms and time. For example, if your breathing is more difficult this afternoon, then I advise you to come and see me.